three respected names: the University of Texas System, the University of Texas MD Anderson Cancer Center, and the University of Texas Medical Branch. Though these organizations have linked and worked together for decades, today we celebrate a new level of clinical integration. It's an innovative approach to keep care local. UTMB Health and MD Anderson are now full clinical partners, with each institution leveraging their individual strengths for the benefit of more patients in this very rapidly growing area. So here we are today in MD Anderson's new outpatient clinic on the campus of UTMB League City. Our corridors connect. Our teams participate in multidisciplinary conferences. MD Anderson survivors who have completed treatment can now see UTMB health specialists for their follow-up care. Inpatient teams with the UTMB hospital on the other side of these walls are able to care for MD Anderson patients who need hospitalization. Today, we're joined by friends, family, employees, and supporters of MD Anderson and UTMB celebrating together. So as we celebrate this collaboration in the new outpatient cancer center, we are very excited to look through the lens of the patient, the employee, and the supporters of these organizations. Shortly, you'll be hearing from 5 special guests. Let me introduce them to the group. Dr. Peter Pisters, President of MD Anderson Cancer Center. Dr. David Callender, President of the University of Texas Medical Branch. Janiece Longoria, Regent, the University of Texas System. Not in order. James B. Milliken, Chancellor of the University of Texas System. And Patrick Hallisey, Mayor of League City. Let's welcome them. We also have notable other guests. In the front row, we have David Beck, Regent, the University of Texas System. Brittany Jewell, Student Regent, UT System. Dr. Raymond Greenberg, Executive Vice Chancellor for Health Affairs, the University of Texas System. Donna Solenberger, Executive Vice President and CEO, UTMB Health System. Dr. Anish Bardwaj, Provost ad interim and Chair, Department of Neurology, UTMB. Charles Mouton, Dean ad interim, School of Medicine, UTMB. Dr. Tanya Callender, UTMB. Dr. Michael Blackburn, Executive Vice President and Chief Academic Officer and Co-Dean, School of Biomedical Sciences, UT Health, Houston. Dr. Trefe, Walelo Trefe, Chief Medical Officer at MD Anderson. Dr. Richard Ehlers, Associate Vice President and Executive Medical Director for the Houston area locations at MD Anderson. And seeing patients this morning, Dr. Amy Hassan, Medical Director, MD Anderson Cancer Center here in League City. Thanks to all of you and many other special guests, we are here today. So let's begin our program with remarks from Dr. Peter Pisters, President of MD Anderson Cancer Center. Dr. Pisters.
Well, thank you. This is an extraordinary opportunity for us to adjust the audio. It's an extraordinary opportunity to bring together leaders from the UT system, leaders from the community, and of course leaders from UTMB and MD Anderson. And together we've had a shared vision that has become a reality. And we'll be able to see that today in this building, but especially through the collaboration that this really represents, as we've really brought together 2 amazing organizations that are part of the UT system. We've thought about different ways of working together. We've thought about this from the perspective of the needs of the community that we serve. And that, I think, that focus, the focus on the needs of the community, has led us to the right decisions that bring us together today. As we've said many times in the past few months leading up to today, this is a historic event in many ways, because we see components of the UT system coming together in ways that have never happened before. And we see opportunity created through that benefits our community, that benefits the UT system, and makes Texas stronger. And as we think about this, this can be a model for collaboration in other parts of the Houston Metroplex, in other parts of the state. And we want this to be seen around the country as ways in which organizations can come together to create greater value and to improve the health care of the community that we serve. So speaking on behalf of MD Anderson and our leaders, we couldn't be happier for today's events to see these amazing facilities, to see facilities that are really designed around the needs of the patients that we serve, to see the teams coming together to do things that have never happened before, and to really be together making history, bringing together the unbelievable talents of UTMB together with the specialty experience of MD Anderson, working together to improve the health of this community, and of course, to continue our progress in making cancer history. So thank you very much for coming today. We're so excited on behalf of the community that we serve here.
Thank you. Dr. Callender, your thoughts?
Thank you, Kent. I join Peter in welcoming all of you this morning to celebrate this wonderful collaboration. We're so excited about this coming together. As he described, we think this is a wonderful opportunity to extend the work of both institutions. I certainly want to say thank you to Kent, to Dr. Pisters, all of our colleagues at MD Anderson for working so diligently to allow us to do this. Likewise, thank you to Donna Sollenberger, all of our leaders at UTMB, working with our faculty and staff who also have contributed thoughts, a lot of work about how we truly come together to do something that neither one of the institutions could do by itself. Also, thank you to Dr. Greenberg and the Health Affairs team at UT System. You all have continued to encourage us, at times maybe even chide us a little, to say, keep this moving. It's very important. We really appreciate that. A lot of people have asked me, well, you know, what are you really going to accomplish? What makes this special? And my response has typically been along the lines of, take a look at the tagline for each institution. Ours at UTMB is working together to work wonders, which reflects 125 plus years of our culture, where our people realize that working well together, working well with others, enables us to set bold goals and achieve broader impact that improves the human condition and human health. And that's what we're all about. Of course, for MD Anderson, it's making cancer history. So illustrative of that focus, that unrelenting effort to eliminate cancer as a threat to humans. So put those two taglines together, working together to work wonders, making cancer history. That's what we plan to do in a way that neither one of us could do by ourselves, and hopefully over the course of time, we truly do improve health in Texas by eliminating the threat of cancer for all Texans and people around the world. So thank you for being here today to help us celebrate the promise of the two institutions' collaboration, and thank you for your support as we move together to work wonders to make cancer history.
Thank you, Dr. Callender. Chancellor Milliken, we'll go in order this time.
Steal her thunder. I don't
Okay.
know. Go ahead. All right. I hate stepping in front of one of my bosses, but I'll do it now just to stay in order. So first of all, I want to say thank you to Peter and David. This collaboration is something that we're all deeply proud of. How important is this? Well, you have 1/3 of the membership of the Board of Regents of the University of Texas here today to acknowledge this and to recognize the work that's gone on here. So I think it's very, very important. So the UT system is a very big place. And I have learned in my 8 weeks in Texas that not everybody understands what the University of Texas system is about and what it does and what it brings to the state. I've worked in university systems for 30 years, and while each one is different, to me there is an underlying sort of fundamental principle that should guide us all the time, and that is that the system ought to be more than the sum of its parts. That it ought to, because of its organization, bring more in the service of the state than individual institutions would on their own. And there are many examples of this that I've seen in the last 2 months in Texas, but there is no example, I think, better than this one. This is a combination of two of our leading institutions that are serving the state, serving the community, but most importantly, serving the patients who are here. Now, everybody in the country, unfortunately, is touched by cancer in some way during their lifetime, whether it's as a patient, a family member of a patient, or a friend of a patient. Now, I've had the experience of being all three. And so within the last 2 years, I went through my own bout and treatment in New York. I happened to be in the neighborhood of another much smaller, less significant competitor of MD Anderson, Memorial Sloan Kettering. But I knew from that experience how important it is to have a community of support. Family, friends, neighbors, even in New York City, you have neighbors, who are part of the process and make it so much easier to cope. And I think the period of treatment and recovery so much more successful. So when I see the collaboration here and MD Anderson coming to League City, I see the kind of thing that benefited me in New York and that benefits so many people that have access to the best quality treatment. And I could not be prouder of what's going on here today, and that the University of Texas system could play a role in helping to bring together these two extraordinary institutions for the good of this community and the people that they treat. So once again, thank you to you. Thank you to the physicians, the nurses, the healthcare professionals that are the ones that are going to make this work in the future and make it such an extraordinary asset of the community. Thanks.
Thank you. Regent Longoria.
Good morning. I'm very pleased to be here on behalf of the University of Texas System Board of Regents. And before I give my comments, I would like to recognize our friend Regina Rogers. Regina, it's always good to see you. Thank you for being here. It gives us great pleasure, Regent Beck, Regent Jewell, all the members of the Board of Regents. We offer hearty congratulations to Dr. Pisters, Dr. Callender for their leadership in bringing this amazing partnership to fruition. It's going to be of wonderful benefit to the patients in this region and certainly to the state of Texas. So thank you for your extraordinary leadership. And yes, Chancellor Milliken, you did steal some of my thunder. And the good news is I'm not going to speak as long. I would like to say that I have often said in my role as chairman of the Port of Houston that with effective partnership, there's no limit to what can be accomplished. And I know that Mayor Hallisey agrees with that. And this facility demonstrates that partnership. It is collaboration versus cancer. The people in this region, as we know, everybody who's been touched by cancer knows that the diagnosis alone can be overwhelming. But it's compounded if you have to leave home for treatment. So what a blessing to have this facility right here in League City where people can be screened, diagnosed, and treated. So we're confident on the Board of Regents that this facility will bring great hope and inspiration and restore health and well-being to everyone that enters its doors. So thank you very much.
Thank you. And Mayor Hallisey.
Good morning. How is everybody? I have to tell you, I did call the Chamber of Commerce yesterday and ordered up a little better weather, but as I look around the room, I don't see anything but sunshine. So we'll forget what's going on outside. We are absolutely delighted to see MD Anderson become part of this family and the collaboration between UTMB and MD Anderson. Of course, UTMB has been part of our community for a long time, and our residents, all 110 to 15,000 of them, make use of that in their clinics all around the area. Now they've got a hospital that they can come to for any problems that they have. And you know, MD Anderson is an addition that is so phenomenal. People call me and say, oh my God, I was driving down the freeway and I saw a sign up on the building that said MD Anderson. How wonderful was that? And let me tell you, in our community, like in communities all across this country, healthcare is a major issue. It's really a major issue when you get to be my age and older. And people that are experiencing medical problems need medical help. UTMB has been doing that, and we are just delighted that UTMB is here, part of our family. It's great. This entire area is going to bloom over the next couple of years, and at the heart of it is UTMB and MD Anderson. Thank you very much for choosing our community. We are absolutely proud as we can be, and we'll be talking about this from this day forward, that you're open, and we'll be sending people to you. Thank you very much.
Thank you. Thank you all for your insights. When you walk through the hallway later this morning down and see, or to the reception, you're going to see some remarkable artwork. If you were to go through the entire facility, you would see all kinds of pieces that were selected by our patients that had meaning towards healing. We recognize that art does a lot when it comes to getting better. This morning, we will be unveiling a piece of art that reflects the integration and collaboration of our organizations. It will be on permanent display right at the intersection where MD Anderson and UTMB hallways connect. It will always remind us how important it is to collaborate together. Before we unveil the work, I'd like to introduce Constance Lowe, the artist who created it. Constance, please join Dr. Pisters and Dr. Callender up by your art. This beautiful work of art by Constance is entitled Fortune's Arc Number 2. It combines not only different materials, but many influences that impact her art, including her family's Midwest farming heritage, Landsat photography, and geometric abstract painting. Many beautiful elements coming together in this special piece. Thank you, Constance. And now we will unveil the piece of art. Very nice. Well done. Thanks. Thank you all for coming this morning. We ask that you join us for a reception down the hallway. Take advantage of looking at the art that is on display. Unfortunately, due to